Good morning, ma'am. Today I will perform oxygen therapy. Assessment. Observe the following skin and mucous membrane color and note for the cyanosis in order to have a baseline data for future assessment. Next is the breathing patterns. Note for depth for respirations and presence of tachypnea, bradypnea, and orthopnea in order to know if the patient have anything problems in breathing. Next is the chest movements. Note whether there are any intercostal, substernal, suprasternal, supraclavicular, or tracheal retraction during inspiration or expiration in order to know or identify the site of abnormalities. Note the presence of clinical signs of oxygen toxicity, tracheal irritation and cough, dyspnea and decreased pulmonary ventilation in order to avoid any lung damage that can cause coughing and trouble of breathing. Determine the vital signs, especially the pulse rate and quality, and respiratory rate, rhythm, and depth, in order to obtain baseline data. Check physician's order for rate, device used for concentration, in order to avoid any errors in administering the oxygen to the patient while ensuring their safety. Planning. Consult with a respiratory therapist as needed in the beginning and ongoing care of clients receiving oxygen therapy. In many agencies, the therapist establishes the initial equipment and client teaching in order to ensure the doctor's order and to have guide on what procedure you are going to do. Inform the client to encourage cooperation and provide comfort. Gather equipments and materials in order to avoid wasting of time. Good morning, ma'am.
Good morning, nurse.
So, I'm your nurse, John Tado, and may I know your name po?
I'm Kia Rivera po.
So, today, ma'am, is I'm going to administer your oxygen therapy, and don't worry, and because it will help you to breathe properly. So, prepare the client by assisting to semi-folders. Provide privacy to the client. So the first therapy is the nasal cannula. It is a thin tube with two small nozzles or prongs inserted into nostrils. This device is used to administer oxygen to a breathing patients with minor breathing problems. It can only provide oxygen at low flow rates, 1 to 6 liters per minute. It delivers a concentration of 24 to 40%. Flow rates greater than 4 liters per minute should be used with a humidification system. And there are advantages. First is the comfortable for patient. Next is ideal for claustrophobic patients. Next is the ideal for oxygen dependent patients requiring small amounts of oxygen and home use. And the last advantages is the humidification or the bubble bottle, not required up to 4 liters per minute LPM. There are also disadvantages. First is maximum estimated FiO2 is at 40% or 0.4, not appropriate for patient in respiratory distress. And you need to watch for must be ordered in liters per minute or LPM, not FiO2. Flow rates greater than 6 LPM can be uncomfortable for patient, headaches, or the nosebleeds. Possible water in the catheter from the bubble bottle will be sprayed up to the patient's nose. Turn flow on before applying to patient. Put the cannula over the client's face with the outlet prongs fitting into the nares and elastic band around the head. Kita na gano'n ako niyo. Next is the simple face mask. It is a basic mask used for non-life-threatening conditions, but which may progress in time, such as chest pain or possible heart attacks, dizziness, and minor hemorrhage. It is often said to deliver oxygen between 5 to 10 liters per minute. The final oxygen concentration delivered by this device is dependent upon the amount of room air that mixes with the oxygen the patient breathes. The general oxygen concentration is between 35% and 50%. There are also advantages of simple face mask. Quick and easy to set up and apply. Often found at the head of the bed in emergencies areas. There are also disadvantages. Non-specific if IO2 or the dependent on patient's inspiratory flows. Next is maximum if IO2 estimated at 0.50. And last is not intended for long-term use. Guide the mask towards the client's face and apply it from the nose downward. And fit the mask to the contours of the client's face. Secure the elastic band around the client's head so that the mask is comfortable. So, today ma'am is okay lang yung breathing ma'am.
Yes, nurse.
The next is the non-rebreather mask. It is an effective method of delivering high concentrations of oxygen to a breathing patient. It is similar to the partial rebreathing mask, except it has a series of one-way valves. Non-rebreather mask consists of a face mask with an attached oxygen reservoir bag and a one-way valve which prevents the patient's exhaled air from mixing with the oxygen in the reservoir bag. Flatter valves on the side of the mask allow exhaled air to escape freely. As the patient breathes, he or she inhales oxygen from the bag. One valve is placed between the bag and the mask to prevent exhaled air from returning to the bag. There should be a minimum flow of 10 to 15 liters per minute. The delivered if IO2 of this system is 60 to 80%. There are advantages. Fast and easy to set up. Can deliver high concentration oxygen in breathing patients. There are also disadvantages. Delivers only 1 FiO2 or 1.00. FiO2 is extremely variable. While theoretically capable of delivering FiO2 of 1.00, realistically it is more likely between 0.60 and 0.80 due to air entrainment around the mask. You need to watch for reservoir bag must always remain inflated. If deflation occurs, the oxygen may flow be too low. This is not a long-term usage mask. The patient should be switched to a 100% aerol mask at the earliest convenience. So next is I'm going to administer the non-repeater mask or the partial repeater mask. So guide the mask towards the client's face and apply it from the nose downward. And fit the mask to the contours of the client's face. Secure the elastic band around the client's head so that the mask is comfortable. Okay na yung ginawa, ma'am?
Yes, nurse.
Last is the Venturi mask. Administer oxygen via a Venturi provides high gas flow with a fixed oxygen concentration. It provides much controlled oxygen delivery between 20 to 55%. Most reliable and accurate method for delivering a precise O2 concentration. Consists of a mask with a jet. Excess bag or excess gas rather leaves by exhalation ports. O2 flow rate is to 4 to 15 liter per minute. Can cause skin breakdown, must remove to it. This type of oxygen delivery is advocated for patients with chronic hypercarbia in the management of moderate to severe hypoxemia. There are advantages. Administer a specific FiO2 determined by the air entrainment adapter on end of mask. Last is the quiet. There are also disadvantages. FiO2 only available according to mask adapters. 0.24, 0.28, 0.31, 0.35, 0.40, and 0.50. Next is I'm going to administer the Venturi mask. Guide the mask towards the client's face and apply it from the nose downward. And fit the mask to the contours of the client's face. And secure the elastic band around the client's head so that the mask is comfortable. So, okay na itong breathing, ma'am?
Yes, nurse.
Dili siya guot, ma'am?
Hindi po.
Pwede ka mo inhale, ma'am? Exhale. Inhale, ma'am. Exhale. For the evaluation, perform follow-up based on the findings that deviated from expected or normal for the client. Relate findings to previous data if available, in order to enhance quality of care to the patient and improve healing process. Next is report significant deviation from normal to the physician. This is in order to enhance the quality of care to the patient. And next is the documentation. Document findings in the client's record using forms or checklists supplemented by narrative notes when appropriate. This includes the flow rates, client's reaction, or etc. In order to determine the flow rate and client's reaction, and the payment of reimbursement of health care services is based on the quality of care provided. Also, note also the reaction in give the needs of the patient if there are any discomfort.